A sobering statistic for moms-to-be. New research shows Black women in Massachusetts are dying at more than double the rate of white women during delivery.
Here to answer questions is Dr. Allison Bryant, an obstetrician at Mass General Hospital. Dr. Bryant, thank you so much for joining us this morning.
Good morning. Thanks for having me.
Well, you specialize in treating high-risk mothers. What can you tell us about the problems you're seeing right now?
Yeah, thanks. I'd love to take the opportunity first to maybe reframe the narrative a little bit and focus on sort of the resilience and joy that is Black birth and birth in the Commonwealth, because certainly for patients, more often than not, birth is a happy and healthy event for them and their families. But that said, as you mentioned, relative to other individuals, Black people are more likely to get sick or even die during pregnancy, during delivery, or in the year after birth. And things that we sometimes see are things like diseases of the heart. So cardiovascular disease is the #1 cause of death amongst Black individuals. We also see a lot of mental health disorders, so things like depression, suicide, substance use disorder, and overdose as the #1 cause in many groups, including American Indian and Alaska Natives. And then there are things like complications at the time of delivery, like bleeding, that may be sort of higher amongst other groups. So those are some of the things that we're seeing clinically that make us worried about risk.
The state is encouraging more women, especially in communities of color, to hire doulas during pregnancy. What's the benefit?
Yeah, doulas really are an amazing part of the birth workforce. So doulas are individuals that are trained as professional support people for pregnant people and birthing individuals. And they provided sort of much needed support and guidance, and in some cases are really helpful in communication between families and their care teams. And so we know that evidence shows that continuous labor support, and specifically doulas, may be associated with a lower chance of having a C-section, shorter labors, and really a better experience for patients and their families. Doulas come at a cost. So traditionally, doulas have been available sort of at out-of-pocket costs. There's a lot of variation, but maybe on the average of $1,000 to $3,000. But now, as you said, Mass Health is actually covering some of the reimbursement of the cost of doulas. And some programs like ours at Mass General Brigham are endeavoring to provide low or no-cost doulas to individuals.
It certainly would be so helpful. We've also talked about midwives, too. What is the difference between a doula and a midwife?
Yeah, so unlike doulas, midwives are actual clinicians who provide care during pregnancy or at the time of birth or postpartum. And some of them provide well-woman care or contraception. And midwives are expert in normal and low-risk births and are going to be an incredibly important part of building solutions that sort of reduce poor outcomes. So I can't say enough about midwives and their positive impact on our patients.
Okay, thank you, Dr. Allison Bryant, an obstetrician at Mass General Hospital. Great information. Have a great weekend.
You too. Thanks for having me.